Who are you talking to?
I am talking to my friend Radhika.
There's no one here.
Can't you see I am talking to my friend Radhika?
What you just saw was not a paranormal video, but a video showcasing one of the many severe mental illnesses called schizophrenia. A Swiss psychiatrist, Eugene Bleuler, coined the term schizophrenia in 1911. Schizo means split, and phrenia here refers to the mind. Even though schizophrenia might be interpreted as splitting of the mind, it does not refer to a split in personality, but a fragmented or scattered pattern of thinking.
Schizophrenia is considered a syndrome, which means it may encompass a number of related disorders with varying causes but similar symptoms.
Every individual with schizophrenia has slightly different symptoms. Some of the first few symptoms may include easy to miss, subtle personality changes, gradual encroachment of unusual thoughts, and irritability.
Patients are usually diagnosed after the onset of psychosis, which typically happens during late teen or early 20s for male and late 20s and early 30s for female.
The first psychotic episodes feature delusion, hallucination, disruptive speech and behavior. Extreme suspicion and doubt may also be one of the major symptoms. These are the positive symptoms of schizophrenia, as they appear only in the schizophrenic patient and not in the general population. Negative symptoms include disruption in emotional behavior, disruption in motivation, and reduction in speech.
People in schizophrenia can also show up social isolation, aggression, compulsive behavior, feeling of self-detachment, and loss in interest in different activities.
There are cognitive symptoms as well, like difficulty in concentrating, memorizing, recalling things.
There are four major types of schizophrenia: paranoid, disorganized, catatonic, residual. The first one is paranoid schizophrenia. In paranoid schizophrenia, it is characterized by paranoid dissolutions and auditory hallucinations. The person with schizophrenia in paranoid often believe that they are being targeted or someone is trying to harm them.
The next we have disorganized schizophrenia. Person suffering from disorganized schizophrenia has disorganized speech or behavior or flat or inappropriate emotional responses. Also, they are socially withdrawn. Person also has a problem with doing daily activities like grooming and hygiene.
The third one is catatonic schizophrenia. In catatonic schizophrenia, the person often believes or often feels extreme movements, including immobility and rigidity. The person often exhibits that repetitive, purposeless movements or echo speech.
Next, the last but not the least, we have residual schizophrenia. In this type of schizophrenia, there is a history of at least one episode of schizophrenia with minimal positive symptoms and mild negative symptoms.
As we have already said, it was not least, the schizophrenia patient cannot be categorized in these categories only.
Yes, and also there are few symptoms which can vary from person to person.
Now that we have talked about the types, the question arises how a person develops this disorder or what are the causes. There isn't one. Schizophrenia has one of the strongest link of psychiatric illness. Although only 1% of people have the chances of developing schizophrenia, children or sibling of person having schizophrenia are 10 times more likely to develop this disorder. But in the case of identical twins, the percentage rises up to 40%. Often immediate relation of person with schizophrenia may exhibit milder versions of traits associated with the disorder. Many genes play certain role, but we still don't know how many or which ones. Along with the genetic risk factors, there are some environmental factors such as exposure of certain viruses in the earlier infancy may increase the chances of developing schizophrenia in near future. Use of drugs, including marijuana, may trigger the onset of psychosis in highly susceptible individuals. These risk factors does not affect everybody in the same way. For those with low genetic risk, no amount of environmental risk factors will lead them to schizophrenia. For those with high genetic risk, moderate additional risk might tip the balance.
Treating schizophrenia can be tricky and antipsychotic medications are often used, but it's super important to combine the effects of several clinicians and health professions, including professions in clinical therapy or counseling, medicine or psychopharmacology. Antipsychotics like clozapine can be very effective at reducing symptoms, but they often come with a lot of additional considerations to keep in mind, like loss and the potential for unwanted side effects like tolerance, dependence, and withdrawal. Best use come out when combined with other like cognitive behavioral therapy, electroconvulsive therapy, job training, and rehabilitation.
You know what's the most important thing in the treatment of any form of mental illness? No, it's not therapy or medication, but the cooperation shown by friends and family. So if you know someone who's suffering from schizophrenia, the least you can do is educate yourself, show them practical assistance, or if anything, empathy. Empathy. What good of a human being are we if we cannot extend basic human empathy to someone who is already suffering? So now, if you see something unusual, or if you know someone who is talking to an invisible person, you know where to go. Not to a Baba, but to a mental health expert. And never Google symptoms or self-diagnose yourself. Let the professional do their job. And I know it's difficult to even convince our parents, but we have to take a step. Because it cannot happen in one day, but surely one day. And I cannot do it alone, but you and I together can. Thank you.